for more than 2,000 persons who arrived in the country from last Sunday, March 22nd, and are currently under mandatory quarantine in various designated hotels and government facilities. We are talking about testing for suspected cases, alongside from this Sunday WHO guidelines on testing for the virus, and in accordance with one's arrival date. This exercise will also be extended to all close contacts of confirmed cases who have been monitored for at least 5 days by our contact follow-up teams. As earlier announced by His Excellency the President, this will be done this evening, 7 p.m. to 5 a.m. in the morning. There will be a curfew countrywide. The curfew continues every evening until further notice. The Inspector General of Police here present will give details on the operations of the same. As you may be aware, last night we lost one of our patients to the coronavirus-related disease at Aga Khan Hospital in Nairobi. The patient had other medical conditions that he was also being treated for. The 66-year-old male, Kenyan, had been admitted at the hospital's intensive care unit and had arrived in the country on March 13th, 2020 from South Africa via the Kingdom of Eswatini. On behalf of the National Emergency Response Committee on Coronavirus and the Ministry of Health, and indeed on behalf of the many Kenyans, I would like to pass our sincere condolences to the family of the deceased. We have also been informed that a South African national on quarantine in Nakuru has also passed away in circumstances that do not seem related to the disease. This is a police investigation, and further information will be communicated to you upon its completion. We have informed the South African Embassy about the incident through our Foreign Affairs Ministry. Again, on behalf of the National Emergency Response Committee and the Ministry of Health, I would like to convey our condolences to our family through the South African Embassy. I would also like to inform you that there are 2 more patients among the 31 who tested positive for the coronavirus currently admitted in the intensive care unit at Aga Khan Hospital. The 2, both male, one a French national and the other a Kenyan citizen. Together with the medical team at the hospital, we are closely monitoring their treatment and they are behaving well. In the last 24 hours, a total of 156 samples from suspected cases of coronavirus have been tested in various laboratories in Kenya. Fellow Kenyans, all the 156 samples have tested negative for the coronavirus disease. Therefore, the total number of confirmed COVID-19 cases in Kenya remains 31.
The National Police Service here outline the following measures which will be enforced with effect from 7 p.m. all the way up to 5 a.m. The curfew applies to the entire territory of the Republic of Kenya. As I've stated, it will take place between 7 p.m. starting from this evening up to 5 a.m. until further notice. It will prohibit all the public gatherings, processions, or movement either alone or as a group during the period of the curfew. The implication of this curfew. The curfew demands that all the persons present within the territory of Kenya shall remain indoors within the said period. This will only exempt 20 essential services which were outlined in the Gazette notice. I'd also like to take this opportunity to direct members of the National Police Service who will be in full swing in operation from this evening to raise roadblocks across the country. No movement of motor vehicles. Any movement which is not exempted in the list of the essential services will be subjected to inspection and thorough scrutiny to confirm they are in line with the essential services they are providing. Will also require identification cards from the personnel in the of essential services to confirm that they are legitimate and also they are on duty.
Already preparing to take advantage to even go to an extent of extorting members of the public. So what is this?
So is the recovered person part of the 31 and then also the person